Hello, I'm Clare Ogden, Head of Support Services.
In our strategy, we set out our ambition to reach more children and adults with ME and their families. This is Debbie and her daughter, whose story you can read in our annual report. Debbie's call to us was one of the 1,700 inquiries that our information and support service responded to last year. The team helps people work through the challenges they are facing, provides resources, and can support people to access other services, including our own advocacy, family support and healthcare services, along with our online forums and workshops for young people and adults with ME. On average, across our support services, 89% of people said they felt more confident communicating with professionals as a result of contacting us. 97% agreed they had increased understanding of their rights and options, and 98% said they were satisfied or very satisfied with the support they received from us. We also set out to increase our reach to underserved communities with a specific focus on people from Black and other minority ethnic groups and those with more severe ME. Last year, we worked with the ME Association and the 25% ME group to produce a guide for people staying in hospital with those more severely affected in mind. And as part of the World ME Alliance, we launched a new resource for clinicians supporting people with severe and very severe ME, designed to support self-advocacy and guide healthcare professionals towards safer, more appropriate care. On the slide, you can see Nola Yiso, one of our interaction contributors who describes the stigma she experiences as a Black woman and as a person with severe ME. Last year, we undertook work on a pilot project with non-white communities in East London, but could not secure funding to take this forward. We know that we, along with NHS services for ME, have much more to do to improve equity of access for Black and other minority ethnic groups. None of the work we do in support services would be possible without our amazing volunteers of all ages who work with us to produce Interaction and Cheers magazines, deliver mindfulness workshops for adults, guide our services for young people, facilitate workshops for young people, ensure all our young members get a handwritten birthday card, and moderate our Young People's Forum that Bella here is a member of. Last year, more than 100 children and young people like Bella took part in craft activities, games and discussions at our Breaking Isolation workshops, just one of the services we offered to address the isolation and loneliness of people with ME. We upgraded our ME Friends online forum with input from our forum users, and along with our Interaction magazine, this helps adults access valuable peer support and understanding. As one forum user commented recently, "I've always found the people on here to be kind and supportive, plus they're the only ones I know who really understand the difficulties of living with ME." This graph shows the outcome of training we delivered to a school in Kent in March, and as you can see, the teaching and support staff found it really helpful. We got similar positive feedback from Cornwall Council, where we led training in April, and we hope to reproduce this with the London Council later this month, all part of our ambition to address ignorance and stigma by providing resources to people with ME and professionals. Funded by the Scottish Government, our Learn About ME project supported health professionals to better understand how to diagnose and support people with ME. When this project ended in March, Learn About ME podcasts have been downloaded more than 1,600 times, and our webinars viewed more than 2,350 times, accompanying Dr. Nina Muirhead's CPD accredited module on ME and long COVID.
Our healthcare service is a holistic service for children and adults with ME and their carers. Our team includes doctors, physios, counsellors, and chaplains who offer multi-faith spiritual support. The team provides tailored, person-centred care and support where specialist care is often absent elsewhere. In 2024 to 2025, we provided over 2,500 consultations, and over half of these were to people who had severe or very severe ME. We provided 128 bursaries to improve access to our healthcare services. People like Rowan, shown on the slide, provided substantial feedback about the impact of our healthcare services, demonstrating both the need and the value of our team's support. However, we know we have more to do to evidence the difference our service makes, and we will build on our annual patient survey to gather more robust data during this coming year. On the 1st of April 2024, we launched our new free young people's counselling services for those aged 13 to 18 years. We developed this service in partnership with children and young people themselves, who provided lots of ideas and guidance through our Young People's Steering Group. We recruited two experienced young people's counsellors who provided an impactful service to 51 young people during the year. In March 2025, with the help of additional funding, we were able to expand this service to include 12 to 13-year-olds, and we recruited another counsellor to support this expansion. Overall, we provided 468 counselling sessions over the year, and as you can see from the feedback on the slide, the service is very much valued and has a huge impact for the young people that use it. During the year, we also sought to increase access to our doctor's service. We recruited an additional doctor during the year and in total provided 111 consultations. Whilst this was lower than we'd hoped due to the recruitment timescales and various absences, we have been able to reduce the waiting list over this financial year. We've continued to work collaboratively with Forward ME on a range of areas, including on healthcare and the implementation of the clinical guideline, the NICE guideline, which was reviewed in 2021. Additionally, as Josh will highlight shortly, we provided significant input to the delivery groups supporting the work of the government's delivery plan on ME, continually highlighting the lack of implementation of the NICE guideline across NHS services. We've input the voices and experiences from people using our healthcare services to support this work and our wider policy, press and media work. Organisationally, we ensure that all of our healthcare services are compliant with the NICE guideline and have continued to raise awareness and understanding with other health professionals, as Claire has already outlined.
Hi everyone, my name is Daphne and I'm the Research Manager at Action for ME. To drive forward ME biomedical research, Action for ME set out, in its strategy, to provide support to early career researchers. In the past financial year, we have continued funding the research of Dr. Audrey Ryback. Audrey holds the first Clare Francis postdoctoral fellowship awarded by Action for ME and is affiliated with the Genetic Centre of Excellence and based at the University of Edinburgh. Her 2-year fellowship, supervised by Professor Chris Ponting, has helped get a better understanding of the role of blood in ME, as well as the risk factors that are linked to developing ME when looking at the general population. You can find out more about some of these recent findings on our social media platforms and through our recent webinars. Elsewhere, and in line with our objectives to co-deliver genetic studies, we continued our work on Decode ME and other genetics projects. We focus on genetics research because finding genes that make someone more likely to get ME can help point to the root causes and biological mechanisms of ME. Decode ME was the world's largest study of ME/CFS. Action for ME worked with people with ME and their carers who gave up their precious energy to make sure that lived experience shaped every step and decision of the project. As Andy very rightly put it, without the community, we could not have achieved all that we have. The initial findings were released in August and were historic. They identified 8 genetic variations significantly associated with ME/CFS, giving a very strong basis for further research to advance our understanding of the illness. Action for ME led a communications and media plan that helped share the results widely with the community, various media outlets, and also with researchers. We have also partnered on the Leukomy project, with the biotech company Precision Life. Precision Life are using Decode ME data and employing a specific AI technique to look at different subgroups of people with ME, how this might link to people's genetics, and also how this might connect with long COVID. We have made sure that people with personal experience of ME were in ongoing dialogue with the Lokomi partners, and that key updates were shared with the community on a regular basis. The project finishes in November 2025, and we will keep you updated on the final results. ME research faces major challenges because there is limited funding, too few researchers, and this also makes it more difficult for there to be adequate coordination among the research community. That's why Action for ME is dedicated to speeding up progress by creating new collaborations and making it easier for everyone working on ME to join forces. In the past year, we were very happy to launch the Sequence ME and Long COVID Partnership Project with Oxford Nanopore, the University of Edinburgh, and the European Bioinformatics Institute. This is the urgent next step needed after Decode ME, using whole genome sequencing to more precisely identify key genes involved in ME and long COVID. We have been working hard on a plan to fundraise and build partnerships so we can secure the 20 million needed to make this study a reality. Our partnerships work has also included setting up the board of the Genetic Centre of Excellence. This is a group that brings together people with ME, the advocates and research experts, and you can find out more on the new website, megenetics.org. The Genetic Centre of Excellence Partnership Board helped shape a funding bid to the Medical Research Council. This project is called PRIME, and its primary aim is for researchers to work together to create at least 15 new collaborations. The project also includes the aim of creating international research networks and building a major public and patient involvement program. It will begin in October 2025. Finally, last year, we were happy to convene 27 international experts in Windsor. This helped us build new collaborations with people who were still new to the ME field. And the attendees confirmed their commitment to work together across ME and long COVID research in the future, and including providing support to some of our ongoing initiatives, such as the Sequence ME and long COVID study.
My name is Liz Ryley, and I'm the Director of Operations with Action for ME. I'm standing in today to give the update for our Head of Policy and Comms, Josh Vince, as unfortunately Josh can't be with us today. Throughout 2024-25, we continued to call on the government for the release and implementation of the final delivery plan on ME/CFS, utilising our parliamentary champions, the APPG on ME, and our press and media contacts. Now in 2025, and following numerous delays, the plan has finally been published. As we have already set out, it is important to mark the plan's publication as an important step towards recognising the scale and seriousness of ME, and we would like to thank everyone who has worked to develop the plan, including the thousands of people from the ME community who inputted into the wider consultation. However, we also remain very clear that the plan fails to address many of the concerns raised throughout the plan's development, and as such, will not create the real positive change that people affected by ME so desperately need. Moving forwards, we will continue to work with the DHSC and other government departments to do the task and finish group and our wider public affairs work to ensure that the plan delivers the level of change for the ME community that it set out to create. 2024-25 saw the release of the DWP's Health and Disability Green Paper, which gathered evidence from organisations, charities and the general public on the current state of disability benefits. Recognising the inaccessibility of the DWP survey, we developed our own accessible version of the survey to enable people with ME to feed into the consultation whilst being able to better manage their time and energy. We collated and analysed the responses, which then fed directly into our organisational response to the Green Paper, which outlined our serious concerns regarding multiple aspects of disability benefits. We also engaged with campaigns from other disability charities, such as signing and sharing Scope's open letter to the Chancellor and petition against benefit cuts. We are continuing to advocate for people affected by ME by fighting against the government's welfare reforms, which followed last year's Green Paper in 2025, utilising our parliamentary champions and feeding into the TIMS review, scheduled to conclude in autumn 2026. We know that real change at policy level isn't just going to happen. That's why we've continued our work to work hard at growing our Parliamentary Champions Network, a group of MPs who have pledged to support our work and their constituents with and affected by ME. They do this in a number of ways, including tabling written and oral questions, tabling and supporting debates on ME, and supporting our press and media work. During 2024-25, 4 new MPs joined the network, and we are now nearing having 20 champions signed up. As we move into 25-26, we are working to grow this number even further, ensuring cross-party support for the ME community. We also directly supported MPs, including our champions, in writing questions to be tabled, ensuring that ME is kept on the government's agenda through formal responses recorded in the Hansard. Furthermore, we continue to meet with new MPs throughout the year, sharing the stories of those who we supported to demonstrate the devastating impact ME can have on someone's life and the lives of their friends and family. 2024-25 also saw a change in government, which led to the APG on ME needing to be reconstituted after the previous chair, Carol Monaghan, lost her seat. We worked to develop support for the APPG, securing the required number of members and helping to elect a new chair, Joe Platt. Since its reconstitution, the APPG has held a number of meetings and set its preliminary objectives for the following 12 months, which include the relaunch and completion of the severe ME inquiry and engaging with the DHSC and other government departments to ensure the full implementation of the final delivery plan.
Hello, I'm Ruth Richardson, the Director of Fundraising and Development here at Action for ME. The total raised through fundraising activities last year was just over £1.1 million. As ever, the majority of our financial support came from the ME community themselves, including donations, philanthropic gifts, membership payments, and trading income from our raffles and lottery. Together, this accounts for over 50% of our fundraising income, and we are incredibly grateful for the ongoing support of the community. These gifts enable us to continue our frontline services for people affected by ME, alongside investing in research projects and amplifying the voice and experience of people with ME through our policy work. We are also grateful to the trusts and foundations who have supported us this year and contributed over £250,000, mostly towards our support services. Our incredible community fundraisers raised nearly £100,000 through runs, cycles, bake sales, hikes, and many, many more activities. Many who fundraise for us do so in honour of a loved one with ME, and we are so grateful for all that they do for us. Our largest fundraising activity of the year is our annual Big Give Christmas Challenge. Last year was our 8th time taking part, and we were delighted to be approached by Big Give during the application stage to increase our target from the usual £100,000 available to charities as a result of our previous successful campaigns. We launched the campaign in December with an increased target of £200,000, and were absolutely delighted to not only meet this, but significantly exceed it, raising over £276,000, including gift aid, from over 450 donors. Thank you to everyone who took part in and shared the campaign and helped to make it our most successful Big Give ever. The money raised helped us to deliver the activities listed on the left hand of the slide, including funding a new UK-wide medical student essay competition that will launch very soon. It also provided income towards our support services, bursaries for people accessing our healthcare services, and to support our network of future researchers. We know that in order to continue to deliver our much-needed services for people affected by ME and create change for the future, we must remain ambitious when it comes to our fundraising activities and explore new avenues for income generation. Our fundraising strategy sets out a roadmap for achieving this, and activities this financial year and beyond include setting up a fundraising advisory committee, including representation from members of the ME community. This committee will oversee the delivery of our fundraising strategy, acting as a critical friend to our plans for increasing income and also leveraging in new opportunities by opening up our fundraising networks. In June this year, we piloted a summer appeal that raised over £21,000 towards our work. We will now aim to increase the number of appeals that we run following the success of this campaign. We will continue to improve our communication with existing supporters and also reach new supporters through digital fundraising opportunities. And we know that to continue delivering our vital services, investing in more research, and amplifying the voices of people through our policy work, we must improve our income year on year. This is against a backdrop of rising organisational costs and the trend of declining numbers of donors across all charities. We are therefore extremely grateful for the continued support of all our donors and supporters and hope you continue with us on our journey to improve the lives of anyone affected by ME.